really the reason that we've got together for these 2 days is to listen to what's happening in PHNs and what commissioning innovation is happening. So it's a very interactive couple of days. And the way we've gone about designing the agenda for this session is that we actually went out and we spoke to a lot of PHNs, we ran surveys, and we just asked them, what are the big challenges that you're facing? What are the topics that you really want to hear more about? And what came to the foreground were two big issues. And that was firstly, outcomes-based commissioning. People just desperate to understand practically how you can apply that. And then secondly, it was about co-design. And so really talking through the examples from around the country where people have actually been starting to co-design with consumers, system partners, clinicians, to actually design better models of care.
Commissioning is a really interesting word. It's a misunderstood thing, and across many countries. And I think that the temptation is to view it as purchasing, and therefore that really all that's happening is it's a mechanism to get taxpayer revenue into healthcare and deliver that through providers of healthcare. And so therefore it's just minimised as a purchasing function. And what people are missing is that we need profound change in our health systems. We've got health systems which are a function of history rather than the needs of the current population. We've got opportunities for technology. We've got people wanting to take much more responsibility for their own healthcare. And commissioning is the means by which we can deliver that profound change.
Our PHN, like all PHNs, has been on a journey with commissioning. I think when we started that journey, we thought commissioning was going to be a very procurement-orientated type of activity. I think increasingly we're looking at a decision point at that point and thinking procurement, providing or partnering as the options that we undertake at that point. We've really refocused the way we work along those lines. We've trained the whole organisation around project management now, and all of our activities are coordinated into projects, whether they're a procured activity under a contract or whether they're a partnered activity or a provided activity.
The challenge for us has been that every time we've done something, somebody's doing it for the first time, if not everybody is doing it for the first time. But equally, it's just been embraced by the community, by our clinicians, and by local service providers as a way to improve things. We've really acknowledged that things haven't been perfect in the past, and by enhancing our planning and our planning abilities, our data collection resources and our procurement, we're actually being able to provide a lot more services to the community, which I think has been really important. One of the interesting things for us has been to bring our local health district colleagues along on the journey, and we are now making sure that when we implement new services or we review services, we're doing those together, so that we're going down a joint commissioning path. And we're now in a space where we're actually combining funds for services, planning them together, monitoring them together, and evaluating them together.
The ultimate test of our partnership is what it delivers for the community, and the great thing about Hunter New England Central Coast PHN and my local health district is that we serve largely the same community. We've had some partnerships that have been working really well, but approaching them differently in the sense of co-commissioning will give us a chance to really deepen those. So I'm feeling pretty optimistic and excited about this new way of partnering.
You've got a need to understand the person, and commissioning is the means by which you can actually have a much more imaginative response to the challenges facing the health needs of a person. So if I had to give a message to Australia, which is to invest in commissioning so you can actually relate to the people and embrace change and deliver a much more person-centric approach to healthcare management.